Hi, this is the voice of Heidie Calero with another fascinating economic capsule on Puerto Rico. Today we are going to talk about what nobody is calling, but it is what it is. It is an essential service, health service for the medical center. And unfortunately, this is a crisis that has been in the making now, not for COVID in the past 2 years, but certainly more than a decade ago. In its heyday, the medical campus was really the crown jewel of the health system in Puerto Rico. It is the tertiary, supra-tertiary facility. As you can see in this first table that I'm depicting here, this medical facility has 12 hospitals for trauma. These are the things and the conditions that no other private hospital in Puerto Rico deals with, and they are all sent to the medical center. You have the hospital for adults, the hospital for children, pediatric hospital, you have oncology hospital, you have a cardiovascular center, you have the other healthcare facilities, 20 other facilities, from emergency rooms, blood banks, you name it. There are so many services, psychiatric hospitals there. That's the medical campus in 225 acres in Puerto Rico. And it's also a teaching hospital because the medical campuses of the University of Puerto Rico are there within that medical center of Puerto Rico. And it is where all these professionals in the healthcare industry are prepared, and we need this crisis to be addressed, and I'm calling attention to that. Let's look at the next graph, which depicts the budget according to the general fund, that historical ones since 2000 through 2022. And the columns that you see there are according to those budgets, what has been allocated and what has been spent in terms of those revenues for the medical center. The blue line is the number of jobs that the medical center has. So as you can tell, back in 2009, approximately, the medical campus had like 2,376 dedicated souls to offering these healthcare services, and they are not well paid. So everybody now has been focusing on teachers and on other government employees. We have to focus on these healthcare professionals, from the board certified physicians that we have there, through the nurses, the professional nurses, and other healthcare professionals there. Well, we have right now, in terms of employees, 1,683. So the medical center has lost around 700 professionals in the healthcare facilities, when it has such a complexity. In fact, and more of the complex cases are coming to the medical center, because once the healthcare plan of the government, Plan Vital, provided in 1993 this credit card to the medically indigent, then the private hospitals could accept all those people who receive the card, because the government, through a private insurance company, is paying for them, which means that the medical center lost those revenues that would be coming to that facility, and now is left with the hard bone, those that are the most difficult, the most complex, the most expensive. In terms of the resources, well, they've lost like 29 million, probably more, and they have been accumulating a deficit. So back in 2007-8, $195.3 million. As of 2022, $185.6 million, as you see in that graph. But let's look at the next graph, adjusting those revenues for inflation using the component of the medical care as published by the Puerto Rico Department of Labor. You can tell that the purchasing power of those fiscal revenues have been going down. From $235.5 million back in 2004, that is about $117.7 million today, 2022. So really, instead of having more real purchasing power revenues, they have been going down, not only in jobs, but also in revenues. Let's look at the next graph, which are the sources of funds. All those green shaded columns that you see there, it's own funds, what the medical center provides and receives in terms of either selling its services to the other facilities, which are part of the component of the medical center, but also they depict an operational deficit which has been covered with special revenues from the and allocations from the legislature, special allocations of the legislature, and even loans. So all those that you see in magenta and even red, they represent an operational deficit. And in the transition document in 2020, they had indicated that the operational deficit of the medical center was approximately $107.3 million year after year. How can you cover that? I mean, at some point in time, this medical center will not be able to provide services, and the crisis is here. Those facilities need capital improvements. Salaries have to be improved. You need technology. And based on that, Promesa has allocated, at least they say that in the certified fiscal plan of January 27, 2022, they say that they have provided like $309 million for technology, for streamlining all this invoicing for the Department of Health. And within that, ASEM, the medical center, receives or has been allocated $50 million. That's about 16% of all that investment to really streamline and improve all that invoicing system and collection system. And the union is already criticizing this private company that has not been effective, being paid, but not yielding the results. And they have only been able to disperse $10 million out of the 50 that they have. So there's a balance of $40 million that 60% of that has not been allocated yet, and it's in desperate need, be it if the Department of Health is now going to be integrated, consolidated with 6 entities. One of them is the medical center. We need to focus on what is an essential service. We cannot allow the medical center, the supra-tertiary facility in Puerto Rico, to go down, and it needs, it's asking for help for a long time. Let's address this because it is in dire need. This is the capsule for today. Don't forget, those of you who like our capsules, to give us a like and to subscribe. Those of you who have not looked at YouTube in the voice of Heidie Calero, subscribe so as to receive new notifications. And don't forget, the economy is all of us. Thank you.